Survey says digital health is optimistic. Find out more on the other side. It's the May 13th episode of Health in 2.00.
Someone did a survey about digital health and digital health companies.
Oh my God, don't act humble. You know it was you.
Yes, well, I had fun doing the survey and putting it out there. And we were all over Clubhouse.
This is great. In the middle of a global pandemic, when healthcare is all in a crisis, one man decides now is the perfect time to go and bother everybody he knows who's trying to run a business and land some funding and ping them via email, multiple emails, on Slack channels, on Twitter, on LinkedIn, on multiple shows on his blog to find out what they think is going to happen next. And that man has emerged with survey results. And here you are.
I would encourage you all to go and look at the healthcare blog or the Catalyst.health website, the Catalyst.health blog, and to see the survey results, to watch the video, the presentation I made yesterday. And you could have caught Jess and me on Clubhouse the other night on the THCB hour at 5 o'clock on Tuesdays. And then tonight, Thursdays, on Andy Mishkowski's Future of Healthcare channel. He apparently is out of guests because he invited us yesterday.
Here we are. And I love how it's like we're talking about whether or not the bubble is bursting. I would say so. No. If we're on Andy's show, I think that this is the beginning of the end.
Quite possibly. Although apparently somebody came into Clubhouse last night to look for you. Go on, tell us.
Yeah, I emailed my good buddy Paul Sims, who used to run pharma over there in the UK, and I was like, hey, like you popped in, you didn't say hello, and he was like, oh, I couldn't. But he's like, I just joined that room to see you, and so I said back to him, I would have been jealous if he had said that he had popped in to see Matthew, and he said, no, Matthew was the reason I left the room, not the reason I joined.
He's lying. It was 3 a.m. and he was too up.
Isn't that
who knows what insomniacs are doing in the UK?
I bait them in and then I switch and it's you and then they leave.
You draw them in, I spit them back out again.
Okay,
right, but I mean, there's a lot of good stuff in that survey data, none of which we're going to talk about in the 2 minutes.
No, thank God. So let's talk about funding. Go. All right, Aetion, our good friend Carolyn Miguel, she gets $110 million, bringing her company's total up to 212. Matthew, what does this one do?
This is real world evidence for pharma companies, and somehow that involves going heli skiing, which she's going to take me. I'm not quite sure how, but they now have about 100 contracts with pharma companies who care about real world evidence about things like, I guess, whether vaccines and all that stuff works. So great to Carolyn.
All right, Halodoc gets 80 million in a Series C. This brings their total up to 180 million. This is an Indonesian telehealth company.
It's an Indonesian telehealth company, you know as much as I do, but seems to be doing well. And don't forget, there is a lot of demand for cash pay in that part of the world. 180 million sounds like a hell of a lot of money for a company that's dealing with, low healthcare costs, but maybe.
All right, MSK startup Vori Health gets 45 million. Can they compete with Hinge?
Well, somebody thinks so, particularly NEA, one of the venerated Silicon Valley investment funds. Thinks so. It's a bit weird. I didn't quite understand on their website. You can pay $189 a month for it without insurance, or $19 a month for it with insurance, but the first month's free. I guess that's the copay. I got a bit confused about how they're marketing it, but very competitive space. There's also Kaya Health and a bunch of others in that space. So good luck to them.
All right, what about Heartbeat Health? They get $20 million as a cardiovascular startup.
Yeah, this is along the lines of managing people with heart disease. There aren't many, there are some high blood pressure products. The Bongo's got one. There aren't many people doing this. Moving analytics is in this space as well. Heartbeats in this, they've got $20 million. It's interesting. Our good friend Jessica Ziski, whose name I can never pronounce correctly, is the main funder from Echo, and she's joined the board. Good luck to him.
All right. Andreesen throws 10.5 million in a Series A to Memora Health. A bunch of other investors in this one. What do they do?
Yeah, I'm a bit confused about this. It looks to me like it's a patient messaging system, which, seen a lot of those, Health Loop and God knows how many others. But they're talking about how they're restructuring the entire process of care. A lot of big words in this one. Are they convinced somebody then? We never got to our last one.
Damn it.
There was going to be teasing and abuse, but we'll have to wait.
Oh, so much teasing and abuse. We're going to have to open with that next time.
Well, it's only a small round, but it's somebody we can tease a little bit for his longevity around the industry. But you'll have
Now,
to do
now you have time to make a chart.
Oh my God. Do you remember talking about people who've been around a lot and done stuff? When Glenn Tillman started Livongo, he both launched at Health People in 2014, but he was also one of the 3 CEOs. You know, we used to have that session. In fact, I think you interviewed Deb Kilpatrick a couple of years later on it.
Yeah.
Was that year? Something I can't remember when. But anyway, and somebody had once produced it. So I was interviewing him both because of, you know, what he'd done at Allscripts and then what he was about to do at Livongo, rather because Livongo then was like just a startup and they'd raised like 8 million or something, right? They were nowhere near what they became a few years later. I did interview him a few years later after they were clearly on their way to.
Wait, time out. Who are you talking about? I lost the plot on this one.
Glenn Tillman, not Deb.
Okay, back to that.
So I'm interviewing Glenn on stage and I put up, there is someone did like it's like, you know, rock bands breaking up and splitting up together. Someone had that sort of family tree of all the companies Allscripts have bought. And it was like about 80. And, you know, company goes along, gets bought by this other company, gets bought. They all fun up into Allscripts. It was too big to fit on one chart. So I actually had the graphics person like scroll down and go across and do a capture.
Well, remember when I invented that game, 6 Degrees of Glenn Tillman? Like 6 Degrees of Kevin Bacon, where any health tech startup, you could get to Glenn Tillman within 6 steps. It's true. Play at home. I mean, honest to God, there is no health tech startup that doesn't have some connection, especially because of the fact that 7Wire invested. I mean, between Allscripts, Livongo, 7Wire, the health assurance SPAC. I mean, yeah, there is no.
The health assurance SPAC hasn't actually done anything yet.
Well, just wait.
I'm waiting for the stock price to go back up.
I'm just saying, the people who are also involved in that SPAC, it's very easy to get to Tillman in 6 degrees.
Oh. Plus, you know, the senior membership, and to figure out, you know, who Jason Gorovich is suing and everyone else. So never mind. There'll be plenty more people suing Jason Gorovich soon. All the securities lawyers saying, "Hang on, we bought the stock at 280. It's now down at 140." She would dip below that.
Stop.
But you told me you saw him on CNBC.
Yeah, CNBC Healthy Returns. Wow. So Bertha Coombs just put him on the spot. She was like, "Amazon cares. What do you think? Overrated or not?" And he looked at her for like a second and you could like hear the PR people in the background, his heart stop. And then he just goes, "Yeah, overrated. I would say they've landed one contract with about 300 people on it. Overrated for right now." Then she asked him about CVS Health, which is a partner of Halodoc. So of course he said, great partner. Can't say enough great things about them. And then she asked him about Amwell. And on Amwell, he said that he thinks their solution is too narrow and that's why he is very much feeling good about his competitive positioning. So we're back. Showing his teeth a little bit. Yeah.
Maybe Roy and Ido should go buy Armada after all that, you know, although their stock ain't quite what it was if they bought it with their stock, you know, 3 months ago. That's the problem when you're a public company, right? Is that if you have overvalued stock, you can spread it around. But then you have the problem that your stock is what you take volatile, I think is the answer.
Okay, so you're incredibly chatty. I'm going to cut you off. So if anybody would like to continue this conversation with Matthew Holt, he loves to talk about
Clubhouse tonight. 5 o'clock.
Yeah, Clubhouse tonight. We'll both be there. You can talk to both of us, or you can go and find him on Twitter at BultyBoy, and you can continue conversations about declining stock prices and lawsuits. Or if you want to play 6 Degrees of Glenn Tillman, you can just find me on Twitter at Jess DeMassa. I'm serious. You can get to him in 6, no matter what happens.
Way less mistakes.
And don't forget to sign up for our email newsletter over there at thehealthcareblog.com to never miss an episode of Health in 2.0 or any of the other great content coming out of the blog. Or you can just subscribe on YouTube. See you later.
Yeah, Jess. Bye.
Bye.